Welcome to the Veterinary Project Podcast, episode 098.
Welcome to the show created by vets featuring absolutely no pets. This is the Veterinary Project Podcast, hosted by Dr. Michael Bugg and Dr. Jonathan Light. Our resident veterinarians have swapped out their stethoscopes in favor of microphones to bring you the Veterinary Project Podcast, a show focused on real conversations aimed to connect this amazing profession full of remarkable people. Through the sharing of collective stories and wisdom and connecting over the many unique challenges we face, we invite you to join our community of veterinary professionals leading intentional lives. And now, here are the hosts of the Veterinary Project Podcast, Dr. Michael Bugg and Dr. Jonathan Light.
Welcome back. That's right. Dr. Michael Bugg, Dr. Jonathan Light, the Veterinary Project Podcast. What's shaking, buddy?
Oh, not much, Jonathan. Just having a good day here. This is totally random, but Rosalie bought like a killer coffee machine, like one of those like fairly fancy ones. So now instead of not so good coffee, we have phenomenal like cappuccinos and lattes every morning. So I'm living the dream, man.
The other day, I was a little bit under the weather. For all of our listeners, Mike is buzzing. I'm like, what's going on? You've got so much high energy. I don't have energy. He's like, I can't handle it. It is so good.
I forgot about that. I think that was when we were recording with Casey or something. And I overindulged in our new coffee machine. And I've never been that wired in my life, like just vibrating.
So funny, but it's cool. Those little things, right? You work hard for it and then you step up the quality of the game and look at what happens. Now you've got more of a caffeine addiction than ever.
I guess so. Actually, it's working well because it's just so good. It's just like, I only need to have like, one a day. Like it's just one very good coffee, except for that example where I had 3 doubles, I think it was.
And are you doing the little espresso shots or do you do them as the full, again, our listeners don't need to know this, but I'm asking it anyway.
I do cappuccinos. That's been my go-to.
Cappuccinos?
Yeah.
Okay. Dairy and all?
I have been, yeah. And I've been trying to trim my dairy down, but I guess in coffee, it doesn't count. That's what I'm saying.
That's how it works. Well, you're making up for it. You're still not drinking either, are you?
No.
Yeah. So
I don't know. No end date on that. That's just like, see what happens.
Excellent. Well, we're going to keep the old preamble short to our caffeine because we've got ourselves quite the conversation today. This one is a long time in coming. Hey, this is Dr. Ryan Appleby, and Ryan was somebody who was first introduced me as a result of our episode with Dr. Alex Zerlinden, your classmate, friend, and he is his colleague at OVC. Ryan and I originally started chatting about artificial intelligence, and then his platform, Obivet, a different way of looking at continuing education in the veterinary space. And then all of a sudden you sent me a message through in April and said, have you read this post? Have you read this blog? And I went, no. He said, you got to read it. I was like, what are you talking about? So I read it and then go, ooh, we need to get Ryan on. You didn't know that time. It was even Ryan, right?
At the time, no, I didn't connect the dots, but I remember in hindsight, I remember Alex mentioning Ryan and being like, oh, you guys need to connect, but it didn't all come together until we were kind of in pre-recording.
That's it. And so in setup for this conversation, Mike, Ryan, and myself got on for a pre-recording that lasted, I think, just for under 2 hours. And here's a great thing. Ryan is at academia, but then he's also involved in multiple different communities in the vet space. Saw a need to share his educated opinion with the masses and did so via his platform on Obivet. And here we are, a few months later, chatting about it on the podcast. And I love this conversation because it both encapsulates things that we agree with, the three of us together, and changes that structurally need to be made in veterinary medicine, but then some pieces that we maybe don't agree on so much as well.
Yeah, I love that he put it out there and that we were able to come together and chat about it.
That's exactly it. So we're going to get into it. Let me share you the bio for Dr. Ryan Appleby, who is an assistant professor of diagnostic imaging at the Ontario Vet College. He completed veterinary school and a rotating internship at OVC, then moved on to complete an imaging internship in San Diego, as well as a residency in diagnostic imaging at NC State University in Raleigh, North Carolina. He was boarded by the American College of Veterinary Radiologists in 2019 and rejoined the team at OVC. His research interests include the use of artificial intelligence in veterinary imaging, clinical applications of advanced ultrasound technologies. He is passionate about teaching and started the website obivet.com in 2021 to provide global access to high quality veterinary educational content in a micro learning format. A lot of great conversation to be had in this next 30 minutes with Dr. Ryan Appleby. Ryan, thank you very much for joining us this morning. We are really excited to have you on our podcast for a number of reasons. You and I have got to know each other over the past year, and our initial discussions actually didn't even revolve around what we're going to be chatting for the most part about. So that just brings a whole bunch of pieces together at once. Mike, myself, and yourself, a couple of weeks ago, we got onto a pre-recording conversation, and that lasts just under 2 hours, something like that, I think.
Yeah, I think it was close to that. It was a good time. I enjoyed that chat.
It was a great time. So I expect nothing less from the next 40 minutes or so. For our listeners that may not know who Ryan Appleby is, bring them up to date. Who are you and what's brought you up to this point in your career? And we'll get into the conversation of the day.
Yeah, absolutely. Thanks. I'll start by saying it's a pleasure to be here. I appreciate the opportunity. I am a veterinary radiologist. I work at the Ontario Veterinary College. I did my DVM here at OVC and a rotating internship here before heading off to the States for 4 years for my training. I did an imaging internship in San Diego and then moved to Raleigh, North Carolina for my residency. And so I came back to OVC in 2019. And I've been here since, and that's who I am. And I started a veterinary education website, obivet.com, which is the home of the blog post that we're here to talk about today.
That is exactly it. And the first time that you and I first chatted was about Obivet and looking at what that could possibly do within Mosaic's organizations and around. And then we got on to AI. And then your partner in crime at OVC as well is Dr. Alex Linden, a classmate of Dr. Bugs. So there is so many connections to be had. But the funny story and what spurred on this specific conversation is Mike one afternoon sends me a text and says, "Hey, have you read this?" And it was the blog post that you posted in a number of months ago now, right? It's not too long, but when did that go live? In May?
It was the end of April.
End of April. Okay. And Mike reads it. He's going, "Do you know this guy? We need to talk about this." And I was like, wait a second, that's Ryan with Obivet. And we read it and we go through it. Mike and I have a couple of conversations on it because the title of the blog post that we're discussing today, the title that you put it on is "The Onus for Well-Being in Veterinary Medicine Should Be on Organizations, Not Individuals." And I went, ooh, there's somebody going there. I like this. And knowing Ryan just a little bit, I see some points for conversation. And as you read through, and we're going to share the link to the blog, but before we go into the details of it, tell us a little bit about what's spurred this conversation to the point that you said, I need to get this on my website. I need to share my thoughts and views further, and also some of the challenges in maybe getting it posted and published.
Yeah, thanks. So that's exactly right. And it was a little bit of a challenge or a labor of love to get it out there. And the reason being is I've been thinking about some of these ideas for probably at least a year, but had started writing the blog posts last fall. So I sat with it for a number of months, just kind of wondering whether or not this is something I should put out there, what kind of tone I should strike with it. And thinking about whether or not other veterinarians and veterinary staff would, I guess, appreciate this point of view that was being put out there. And sort of the impetus for it and what I started to think about was I saw all these posts, all these blogs from other folks, or maybe webinars, courses, ideas, and from some real thought leaders in our industry who I respect, I admire, and I love what they're doing. They're trying to make changes and improve our profession. But the conversation was all about what individuals could do for self-care. And those pieces just did not resonate with me as an individual at all. And I know I at least had some friends who those kinds of things were not resonating. There was no time for self-care in their day, and they didn't feel supported by the organizations around them. And that's sort of everything from the clinics they might work for, to the veterinary medical associations, to anything that's sort of surrounding veterinary medicine. We've all recognized that things are not great right now. You know, there are certainly some shining moments and shining aspects of what we're doing, but the profession needs to change for longevity and for everyone's well-being. And those changes need to come from a systemic place. We need systematic overhaul of the way we're doing things to be able to get to a point where everyone is sort of, you know, enjoying their work and feeling fulfilled and you know, practicing the best veterinary medicine that they can. And so, you know, I saw this as an opportunity to talk about how we could change the conversation, and especially voices that have those voices in the industry to say, hey, let's talk about this differently. Let's talk more and more about what organizations can do, not about how people can practice self-care.
Okay, let's dig into it, because we, in many aspects, are on the exact same page. And there's a couple of quotes that I want to bring up through this conversation, which really identify the difference between individual self-care and then what an organization can allow or needs to ensure is allowed to happen in the workplace so that those self-care attitudes can take root. Your first podcast, your first quote that I want to take care here is, right now, most of the conversation about well-being in veterinary medicine, as it comes from professional bodies, companies, and veterinary blogs, centers around what individuals can do to practice self-care. So exactly what you just mentioned, whether it's meditation, journaling, practicing yoga, exercising, etc. All of these are good ideas. And again, I'm still quoting things that I personally support and agree that every professional should do. But what is missing from the conversation are external factors outside the individual's control, which makes it difficult, in some cases impossible, to practice self-care on a regular basis. End of quote. Ryan, what are some of those external factors that you think are preventing this from being able to occur?
Yeah, thanks for that. I think for me, the external factors that are out there center a lot around the culture that we've created. So we've created a culture where we're trying to jam pack our days with as many appointments as possible. We know that clinics are, understaffed, people are overworked, but we're trying to fit in as many patients and clients as we possibly can. And a part of that comes from this overwhelming desire, this need, this sense of responsibility towards our clientele and the people that we're serving, to see them and to help their pets. And I think that it resonates with a lot of veterinary professionals. Most of us got into this because this is our calling. This is our vocation. It's not just a job. It's really what we're here to do. And so there's a lot of feeling of responsibility about seeing those patients. But that in and of itself, I think, is driving a sense of overwork. And so the job demands that everyone is facing on a day-to-day basis are outpacing the resources that are available in every clinic. And that is in part resources directly from the clinics themselves, but it's also resources, like I said, available from those organizations. So I think those external factors that are contributing to this are, allowing those practices, that culture, to persist. And there are things that can be done by these groups that can change that. They can direct the stream, so to speak, towards something that's going to be a little bit more sustainable, a little bit better. We can't get around the realities that there are, more pets than ever that need care, and challenges on staffing and things like that that aren't changing anytime soon. We're going to have to deal with this, and we need to find a way to navigate that, in part with some really directed support from these groups of people. So
in your setup for bringing forward this blog, was there discussions that you were having both within the academic field and or within private practice versus corporations, which were leading you to think this thought process in terms of, hey, there's too much supply here. We have, or sorry, excuse me, too much demand here. And the supply, we know we're short right now, but it's not being looked after appropriately. Is that, something that you kept hearing over and over? Was it, I'm trying to get into the depth of the details of what propagated you going, I need to publish this. I need to get it out because structurally this needs to change.
So, for me, a lot of it was framed by my own experiences. So I didn't go out to groups and corporations and, survey them or anything like that. But obviously, being in the profession, I sit in all the Facebook groups. I talk to my classmates, colleagues around the hospital, students that I see come through. And I'm keenly interested in kind of keeping an eye on what sorts of things are going on. And, we talked a little bit about this pre-recording about, the voice of the vocal minority and whether or not, some of these challenges are that or not. And I'm not sure, I'm not 100% on that, but I think that a lot of the challenges that I heard other people talk about, I'm seeing 25 patients in a day and it's just me and a tech for 2 doctors. That is widespread amongst many clinics. Many of my classmates are experiencing that. And I think we're seeing people leave the profession as well, which is driving a lot of this. And then for the conversations, the talk about it, everyone's recognizing the burnout, they're recognizing the need for self-care, but the solutions that are being put forward are, well, you can do this. You can find ways to meditate more. You can find ways to fit in exercise into your schedule. And I think that it's unrealistic for an individual who is feeling that burnout to be, so exhausted to sit there and go, okay, I can see my 20 patients and then I can go home and hit the gym. And I think that something just needs to shift, that the demands on that individual, if they're going to see 20 patients, which might be the reality, there needs to be more supports around them. They need to be set up for greater success before coming back. So a lot of it was just shaped from conversations I was having with friends, colleagues, looking at, different internet posts and reading different articles. And that's kind of what shaped what I wanted to put forward.
Mike, anything to add to that?
I don't know. In listening to this and in reading Ryan's post, I agree on the fact that environment is everything. Like you cannot out willpower a bad environment. The environment will win over time. Maybe you can buck the trend for a day or a week, but eventually the environment will win. So I completely agree that the conversation needs to change from, I kind of laugh, that Merck study. My favorite part of the Merck study was the stat around yoga, and they broke out distressed vets versus non-distressed vets, and there was a 1% difference. Like, it was nothing. And I'm not picking on yoga, I like yoga, but for some reason yoga is the darling activity of wellness. And it's like, well, and I think you maybe even said it in your post somewhere, Ryan, no amount of yoga fixes this. This isn't a yoga problem, it's an environment problem.
Yeah, that's 100% true. And I don't want folks to take away what I'm not saying. I'm not saying people shouldn't be doing yoga, people shouldn't meditate. Like, I love doing those things when I have the time and when I'm able to, and when I can create that space, or the environment around me creates that space. I think self-care is one of the most important things that we can do. And I mentioned that in the post, right? It is the individual's responsibility to be aware of self-care, be accepting of any training given towards it, and to practice it when time and space allows. But the challenge that I'm seeing is that time and space is not allowing right now. We don't have that bandwidth in our profession. And so we're trying to push a solution into a situation where the environment just doesn't support that.
Interesting. Okay. So then from an environment, when you say the environment's not supporting, you see that as a structural saying, hey, the veterinary industry right now, demand and supply, they're not equal. Therefore, the structure according to the organizations are such that they're not making enough change to allow this to happen.
That's exactly right. Yeah, exactly. And I think they need to spend a bit more time changing their priorities to kind of put that new structure into place.
Okay. So then that goes into the second and the third part of your vlog, which is perspective on changing priorities. And I'll quote again, there are organizations out there with their priorities straight. But the experience that so many have felt in this profession are that profits are at the top of the list at the clinic level and patients are at the top of the list for VMAs and other organizations. Every organization needs to put its own people first. While this might sound like nails on a chalkboard to leadership and management, I see it two ways. Either keep the status quo and run people into the ground and out of the profession, or make large-scale, meaningful changes to put people first. Priorities should look like this. Number 1, staff. Number 2, patients. Number 3, clients. And number 4, profits. Ryan, end of quote. Tell us more about that, because you and I and Mike spent a lot of time talking on priorities and the next piece in terms of the perfect practice list.
Yeah, for sure. So I stand by this list. I think that our staff need to come first, and with the staff coming first, the others will follow. We need to be supporting our veterinarians, our technicians, our assistants, our reception staff, our practice managers. Everybody in the clinics needs to take top of mind, and we need to be treating them well first. We need to be creating an environment that's going to support their well-being in order for the longevity of our practice, our profession, to survive and to keep going. So I think that they need to come first in a meaningful way. And what that means to me is changing that dynamic, that culture, right? No more stuffing in appointments into lunch hours, no more having people stay late to finish things, changing the way we do things in vet med and the culture around it that will facilitate the staff's well-being, improving the pay for, especially, I think we've seen some shifts over the last couple of years in veterinarian pay, but not as much for our staff. And I think that really needs to change in order to retain them, to support them. And so we need to do things to put our staff first. And following that, our patients and our clients will follow. And this is, I think, the sticking point that we might disagree on is, where do profits fall on the list? I mean, I understand, I'm not naive and I'm not like out to lunch on this. I understand that we operate a business, but perhaps I would suggest that this could be a business with a lower margin than is currently being operated at. And I think for me as a veterinarian, and I can only speak for myself, but I think this applies in a more broad sense, it is very difficult to see practices being bought for huge amounts of money, only to see those practices not see the same influx of cash to change the way they work and to support the people in that practice.
Big words there and big points. Let's start with the staff and patients, and Mike would welcome your perspective on this as well. And again, from the standpoint of your blog, Ryan, this is fantastic. And I know for a fact, I worked with it through our organizations. When we put staff first, good things happen. That has been difficult the last 2 years, especially in the times of COVID, where we have gone from everybody being able to come in, chat, relationship build, to hands off, time out. Nobody's coming into that practice. Nobody's coming to the exam rooms. We can't even see each other. How do you build meaningful relationships and people connections when COVID has occurred? But we're hopefully coming out of that end. Structurally, when you say people taking time off for lunches, getting breaks, feeding in extra appointments, it is difficult. It is absolutely difficult, because for every one of those appointments you're not feeding in, there's somebody at the front taking it, meaning verbally abused. And again, that's a whole different conversation in itself, to how that can't be happening, shouldn't be happening. Social media, and then changing priorities in order to be able to ensure that we have the team to cover those appointments, meaning how do we hire the people to get in the hospital in order to be able to support the patients coming in anyways? It is a very complex problem right now we're all undertaking.
100%. And I think, if I could point to a downfall of my blog and my article, it probably oversimplifies things, right? It puts it out there as kind of, this is what needs to be done. And maybe it doesn't dive into those challenges and that complexity. And I fully agree with everything you're saying. Like, this is the most challenging thing that we're going to do. But that's why I think we need to start that conversation and start having more conversations around the systemic changes, rather for organizations, not for individuals. Because it's the most challenging thing we're going to do, and we need to. Otherwise, we're going to have, mass exodus, I think.
I love it, Ryan. And that's why we wanted to have you on the podcast. When Mike and I first went through your blog, I had some pretty strong comments and some against it. And then we chatted for an hour and a half. I went, okay, I need to reframe. I need to take some time and address what, again, I think you were after, as opposed to what my thinking was. And going, we actually have a lot more in common than what we think on this.
Yeah, I think we do.
Our world right now. But that also speaks to what we're talking about in terms of people's personal wellness, mental health, change in terms of EDI in the workplace, all these pieces. In having discussions, conversations, and the real, as opposed to the fluff, change happens.
100%. That's right. And I think that, what you mentioned about EDI is so important. I think that, we can talk about sort of that really plays into the individual responsibility versus that organizational responsibility. We can talk about responsibility that individuals might have all we want, but if we want to promote a diverse workplace, if we want to support people from, varying backgrounds, be it any type, we need to offer support that are going to help those that might not have the privilege to make decisions and changes to either not do this or do it part-time or things like that, right? There are people in our profession that want to be here, that love what they do. This is their vocation. This is their calling. They want to be here. And we do not create the support and environment to allow that, to promote that. And that in and of itself has a negative trickle down, right? If we're only sort of collecting and curating a profession of one group of people, then we're going to have negative well-being down the road for the pets, for the clients, for our teams. We're seeing less diverse teams, which is challenging, and we need to tackle that. And so that's where tackling well-being from a systemic point of view is going to fix it all.
Love it. At a national, we just did our ABVMA leadership weekend over the past couple of days, and I can speak to the Western colleges as well as organizations that this is definitely being looked into further with money behind it to support surveys and additional action items. I see that across North America, but is it quick enough?
Yeah.
And is there a change that is coming, whether we like it or not? Yes. What does that look like? Not quite sure yet, because as I had a friend reach out that I haven't spoken with a couple of years, and she made mention, I think the next 5 years in veterinary medicine is going to be hard. I agree 100%. With her on that point.
Yeah,
I do.
I'm in full agreement with you. I think this is going to be a tough stretch for us. 100%.
I'm laughing because I want to be like, so the last 5 weren't, but I totally agree with what you're saying, but it's just like, there's more tough slog ahead.
Mike, I love it. There's probably listeners that were like, I was ready to hang that up or hang up the podcast until you just said that. It's like, you jackasses, what's the last 5 years look like? Change is difficult. Change management is difficult. I want to go back to a little bit on your view, Ryan, in terms of organizations versus the individual.
Yeah.
And accountability. Where do you see that stemming? Because again, we in our pre-recording discussed individuals having 100% accountability to their own actions, where they are in practice or where they decide to stay in practice, as opposed to the organization. What's your view on that, in that perspective?
Yeah, I don't think that we can give them 100% accountability. I think that is they have some responsibility, certainly. I don't know that I can land on a percentage, but I think to say that an individual has 100% responsibility for their well-being is naive to the situation of different people. It might be possible in some instances for an individual to get up and leave when they don't like their work environment, when they don't like what they're doing and seeing around them, but it's not the reality for everyone. for a variety of reasons. One, as practices continually get bought up, it might be the same work environment everywhere in that area. Two, there might be people that can't deal with that financial insecurity for even a short period of time. Obviously, we're in a very lucky period right now where, there's a huge demand for veterinary jobs. But, when I think about colleagues in the States, especially, we're all here in Canada, very lucky to have healthcare. But if there's that period of unemployment, that becomes really challenging from a healthcare perspective in some instances in the States. There's a lot of moving parts for different people that might prevent them from making a change if their work environment is not 100% for them. And so why can't we ask more of our work environment rather than asking people to change and drive it from that perspective? You'd have to have some exodus from a clinic to maybe see some systemic changes in that one practice. Why can't we ask more of the profession as a whole to change some of those things for the better in those practices, and then, drive that responsibility from that perspective and come, the organizations have the power, not necessarily like just monetary power, but just people power, groupthink, all of it. It sits with large bodies. And I'm not just talking about corporations, which I think is like a lot of the way this gets kind of spin, but it's up to our governing bodies to start to think more about the well-being of veterinarians and veterinary staff.
Yeah. This is such a tough piece, because I can listen to what Ryan says and nod along with like so much of it and be like, there's so many strong points. Where I differ a little bit is when I look at the self, I consider it, and you're absolutely right. Like I'm not trying to be naive to individual circumstances, because there's a whole host of situations where, yes, this is a difficult situation. I look at it as sort of the idea of 100% in quotes, responsibility coming from a place of empowerment. Like whatever situation you find yourself in, the events that have happened, and here we are right now today. And if we take the stance of, okay, what can I do about it today, versus I will wait for the organization to change for the better, like it just has a different empowerment message to me. And that's where I land more on the probably tilting to the side of the individual being responsible. But I mean, it's almost like it's getting into semantics, but that's just sort of a differing view on that.
Yeah, I can appreciate that. And I think that we're probably arguing for the same thing, right? We're arguing for change, and we're arguing for change to happen. And I can see where you're coming from on that, you can't just be passively waiting and complaining about the world around you. And that's certainly not what I'm advocating for. I think that, people can get involved in organizations to help spurn the change, that folks can organize in ways that they haven't organized before to help spurn the change. We can talk about that dreaded U word all we want. Maybe people need to organize on a very strategic way to get things that they need and want in this profession. And that's not to say that there isn't some individual responsibility, but there are ways in which organizations can help facilitate that and can promote it and drive it that isn't being done, in my opinion. And that's where I want to see more onus on those organizations as opposed to those individuals. You're absolutely right. We cannot have people just sitting around complaining and waiting for the organizations to drive change. I'm in agreement with you on that. But at the same point in time, the organizations can't just sit back and say, well, we don't have to change because the individuals can do it for themselves.
I want to bring the people side into these organizations, whether it is VMAs or corporations, of which I am a member of both.
Yeah.
There is a lot of negativity in vet med. I heard it on the weekend and certain discussions we were having it. I have it within the individual colleagues' conversations. This is exactly what I think both of you two are speaking about together. If we want to make structural change, one, organizations are human. Corporations are still driven by humans. And I sometimes feel that it is easy for people to be negative on a corporate, on the ABVMA, on a veterinary medical association, etc. and we dehumanize it in order to make it the devil or bad, because that is easy to do. But then I hear Mike's comments in terms of 100% accountability. I hear Ryan's comments of, well, maybe structurally organizations need to raise up. They're the same thing. If you want to make a change, quit bitching about it. Quit talking about the negativity that is veterinary medicine, which is actually in place. And there is a lot of negative right now. But guys, we have the ability to make a difference together as a group by getting infiltrated into those organizations. You know what? They want you there. The VMAs, we were at this weekend at the conference, leadership conference. Great to see individuals that have been in practice for 35 years, 50 years. But then to me, it's even better seeing the younger ones. I'm a 2009 grad. I'm not that far out, but I see a 2015, 16, 18 Young Vet of the Year award. And I go, that's the future. We need that integration into our organizations. We need that integration into our corporate leadership with a diverse view of what's happening in the world to create the change we need. And that piece pisses me off when all I hear is negativity, whoa, you're bad, whether you are a VMA or a corporate, when it's actually still just run by people.
Yeah, fair enough. And that's certainly not the tone I want to strike in what I'm saying, right? So I am arguing for that organization.
Yep.
All right. As long as the folks listening at home, if that's the message that you've taken from me, please don't. I agree 100% with what you just said. I think that we need to get involved. We need more people to get involved. And I'll say, I said this to my students this week, I do a little introduction with them to their clinical rotation, find out what everyone's interested in. And this group of students that I sat with this week was the most inspiring group of individuals I have talked to in so long. And it's that kind of stuff that keeps me working in academia and wanting to see this, because it's just so amazing. Like they lift you up. They're like, we're going to do this. We're going to help in community practices. We're going to get involved in here and there. And it's like, yes, this is what's going to drive these changes that we need. And 100%, people need to get involved in the organizations to make them work. I 100% agree with what you're saying. But then once they're there, they need to look for those structural things they can do and maybe step forward in a way that I think there has, and I'm not calling out individual groups. I think there's been, amazing work across the board in different ways. I just see it as we need more, and we need more a little bit quicker to help with that. Yeah.
So move in that direction a little bit, Ryan, if you were to say, hey, when I initially put this blog post out in April, what was your hope? What was your hope for its view in the veterinary space, and or what possibly could come as a result of you putting, what is an opinion, and an opinion based on fact, experience, etc. Where did you want it to go?
Yeah. So I think exactly what we're doing right now. I wanted conversation to happen. I want us to start to talk about ways that this can change and this can be different. And if people disagree entirely, if people, look at it and say, no, this is wrong, we need to have, a way for every individual to have self-care, and that needs to be the focus and the primary driver, then that's great. And I want to hear about it. I want to know about it. I want to understand why folks feel that is the correct path forward. But just conversation surrounding it and starting to talk about things that groups can do to make these changes on systemic levels and any direction. So yeah, that's exactly what I want. Conversation, excellent. Discussion.
And have you felt that you've been able to do that?
Yeah, I think so. I mean, I appreciate you both offering me this opportunity to have exactly that. I want to be able to talk about, the pieces and that would fit into this. I think that, when the blog was put out there, it was viewed a lot on our site and started to generate some conversations and discussions on Facebook and on social media. And I appreciated that. And, there were folks that came forward and said, hey, I don't think this is realistic. You've said you need to have a dedicated tech and assistant for everybody. And that's just not going to happen. That's not the reality. We can't do that. And that's fair. I see it. I get it. I understand that there's going to be some financial limitations to some of these pieces, but how are we going to create a world where that is possible, what are we going to do to make that possible? Does that mean that profits have to come last, and maybe even for a period of time? Even if it's, if the next 5 years is projected to be hard, or the next decade, do profits or decrease over that period of time? And this is a less profitable business for a decade to get us back to a sustainable level before it becomes a profitable one again. I don't know. I'm not, I don't have every answer, but I have a series of things that I want everyone to start thinking about.
Excellent. Well, we bring on guests, and again, I don't know if we want to jump into the profit section, or maybe we do, and we touch that. We touched it in the pre-recording a little bit, but and we talked about this as going, shoot, we need individuals to take risk and going into business. Again, this is my perspective. There needs to be profits at the end of the day to make it worthwhile. And again, that level of profitability is up for discussion all day long. I absolutely agree with you that, hey, we lose a little bit of margin, we can gain a lot, but there's only so far you can go down on margin before that business doesn't exist anymore, that's a reality business. This is not something that is it's private entity.
Sure.
Yep.
Yeah. And that's fair. But I think that the successful businesses are probably, the successful groups are pushing those limits. And I think that the ones that are going to succeed in this time when things are changing are going to be the ones that push the limits towards people first. And maybe that does decrease it a little bit, but maybe in the end, long run, long term, it comes out well far ahead. And that's too where I think there can be a protective role for the VMAs. I think, and I'm going to go out on a limb, and maybe we can scratch this if I get it wrong, but I believe it was your group, the ABVMA, that put out that website or that information package for owners to understand the cost of care. Yep. Like, yes, like that needs to exist everywhere. That should be a Super Bowl ad. Like, why are we not taking the money that exists here and putting it in front of everybody? Like, the entire world needs to understand the cost of care, right? We need to educate the public. And it falls on individuals, even individual clinics, to educate the public on the cost of care. And that leads to challenges down the road, right? And it all trickles downhill towards that. But let's use the support of organizations in a protective role to help with that as well, and to help support an idea that drives us towards more supportive practices for the people in it.
Agreed. Couldn't say it better, and you just made me proud by saying that, because we just had that as a part of our discussion on the last council, and multiple hundreds of thousands that are ensuring that our public know what's in place for each of our veterinary practices out there. More to come on the large animal side as well. Ryan, we're at time already, but I don't want to stop here. I do want to briefly hit on what your perfect practice wish list is. And this was I think a nice finish to your blog. I appreciated it because it wasn't another just woe is us, woe is the negative. You actually had what, from your perspective, was your solutions available. Tell us a little bit about them.
Yeah, thanks. So, for me, it all stems from the same thing. So it's like, what systemic pieces can we put into place that are going to fix this at a practice level? It's going to be appropriately staffed, and it's going to be increasing the pay. I think we're really getting close to where that pay should sit for veterinarians. And I admit that I might be a little undereducated on where that's sitting right now, but from stuff I'm seeing online, folks are getting there, and it's great. But I still think we have a ways to go for our support staff and paying them a little bit better. I think paid parental leave is incredibly, incredibly important. And what I mean by that is, in Canada, we're very lucky to have a support system that provides for parental leave, but maybe topping that up at a clinic level in Canada if we really want to, go out there and really support our individuals in our practice. And obviously in the States, I would love to see some more support, longer parental leaves and supporting that. And that's 10,000 podcasts unto itself. I think the technology that exists in practices needs to be improved. Obviously things have changed a lot in the last decade, but even more, right? Let's get some dictation software in people's hands. We look at the way physicians practice and how they get through a volume of care that they get through. They are dictating their notes, right? There's no reason why we can't have a high quality dictation software that integrates directly into an EMR and works seamlessly for people, right? No more clunky EMRs, stuff that works, stuff that talks to other systems. Like, let's make it streamlined and supportive for people rather than having to fight that as part of their day. I think I mentioned it earlier, but a tech and an assistant for everybody, to me, that's super important. I think that, maybe I would say that as a general recommendation, the way I kind of see it. I think that that's how you can get through the most number of cases and support and have veterinarians do a role that is specifically for vets and use those support staff to be able to do things that they are excellent at: client communications, filling scripts, all sorts of things that they can be doing to support the practice. And then it's a kind of a time thing as well. Like, the last 3 points I had on it were time. So I want to see time built in the day for professional development. And that, I admit, ties directly into what I want to do with Obi, which is, let's give people time while they're being paid to learn the things they need to know to do their job. And so part of what I want to do at Obi is make that time shorter so that it can actually fit and it can actually work, but put it in the day. Like, give people some time so that they're not 9 o'clock at night sitting down for a webinar that takes an hour and they fall asleep halfway through, and no way. Time built in for callbacks. And I think everybody needs a lunch and 2 breaks. That's standard for every workplace. So, that's my perfect practice wish list. The one thing I wish I put in there that I think could help would be some social support. So I'd love to see practices do more with social workers or other types of folks to offload some of the job that veterinarians and staff do to support clients that are grieving or challenged by situations. And I think that, we do a great job, and veterinarians are amazing communicators and veterinary staff are amazing communicators, but we could lean on professionals that are adjacent to us to help with that.
All right. I think I look at this perfect practice wish list, and as a clinic owner myself, I don't see these as being ones that are out of the realm of realism whatsoever. Some take a little bit longer. Some are in place already, and some just a measure of time and structural change, just as we've spent this whole episode discussing.
I love it. Yeah.
Yeah, definitely.
Cool.
Mike, before we go to the impact round, anything in summary or follow-up?
Yeah, a couple of things on the last note on the practice wish list. And I know this is nuanced, but there's a guy I follow big on values who talks about, like, show me your calendar and I'll tell you what you value. Right. And if we look at a practice calendar over a long enough period, obviously there's curveball days in there, that should give us a good sense overall of what that practice values. So I'm tying this in, Ryan, when you talk about, staff being number one, this all makes a lot of sense. If staff are number one, you would see that reflect in the schedule of the day, right? Because that's what you value. So I'm more just saying this maybe for our listeners, because that doesn't lie. And I'm not trying to say it with the word lie as in anyone's being malicious, but it just, over a long enough time period, it tells the truth. How you spend your time is what you value, right? So just a comment on that. And then kind of the closing comment, Ryan, I was thinking about this even this morning before we jumped on. And for our listeners, when we saw your blog post, and then I believe Jonathan had reached out to you, interestingly enough, we were already sort of circling around you to discuss AI, and then this blog post kind of just slid in front of it. But what I really, really appreciate is we said straight up to you, we're like, we've read your blog, we love it. However, there will be things we don't fully agree with. And we said that up front. We're like, let's jump on a pre-recording. And you embraced it. And as you've said, we're all basically shooting for the same thing. We just have little differences on how we might get there in perspective. But what we did not do was get mad at each other and, call each other down and say, I'm never chatting with you again. And it's like, I feel like that's what's missing in the world was, when it's like, okay, there's parts we disagree on, but there's the most important part we do agree on. How do we get there? So I just am saying kudos to you, Ryan, for putting it out there, jumping on with us. I really appreciate it.
Yeah. And kudos to you for, challenging me, for voicing those differences and being willing to hear my perspective and giving me the opportunity to just talk. I 100% agree. Like I said, this is my goal for this was to create and generate discussion. And maybe, the this version of it might not be exactly what happens in the world, but as long as we're talking about it and we're starting to generate the idea that, you know, there are parts of well-being that need to fall to these organizations, and what are we going to do to change the environment around us, that's great. Like, it's awesome. And I appreciate the conversation. And, you know, the exact opposite of getting mad at each other, I feel like I've developed friends through this conversation as opposed to enemies in any way. So it's great.
Absolutely agree with that synopsis as well too, Ryan. Okay, gentlemen, wise words of wisdom from both of you. We now have to move over into the impact round. So for Ryan this morning, our impact round are a series of short questions of which you can answer to whichever way you'd like to go. And I'm quite interested to hear a couple of the answers for you. So we'll start off. Is Ryan a cat or a dog person?
I think this is the question I've been dreading most throughout this time preparing. I can't decide. I'm sorry. I absolutely love both. I'm sure that's the cop-out, but I once had a friend describe me as Elmira from Tiny Toons. I don't know if that probably references maybe slightly outside your gentleman's age gap, but in the 90s, early 90s, there was like the Looney Tunes segments, and you know, she would grab those animals and just hug them tight, love you and squeeze you and make you all mine. I do that with far too many pets. So I have 3 cats and a dog, and I love them all. So I can't decide.
Mike, I'm totally going outside of this. Mike, are we going to allow that? Is he allowed to take the middle round? The middle?
I think we just say he's got 3 cats and 1 dog, so he's got more cats than dogs, so he said cats.
That's what I hear.
But from a weight perspective, though, I have more dog, right?
We don't count that.
No. Cats win. All right, another block. Sorry. True or false? I knew I wanted to be a veterinarian since I was a kid.
Yes, I did. I briefly took a stint towards maybe I'll do human medicine and came right back.
Came back. Great moves. How would your friends describe what you do for a living?
Yeah, they think I'm a vet, so I don't think they understand veterinary radiology. Get a lot of questions about dog ears and other sorts of parts of the body that I know nothing about. So I'm a vet.
You're a vet. Yep. What is your favorite hobby?
That's a good question. I think thinking about what we said about time, your time doesn't lie. I guess my hobby is watching TV. That would be what I spend a lot of time doing outside of work. But I don't know that that's fully true. I enjoy collecting records and I enjoy exercising. So I'd say those are probably my 2 biggest hobbies.
And for TV, sitcoms, documentaries, movies, what floats your boat?
I love everything. I like sci-fi and fantasy. I can't always get my wife to watch those. So yeah, we watch a little bit of everything. So yeah.
There we go. Perfect. What in this world are you most grateful for?
Definitely my family, you know, my wife, our pets, and my extended family as well. Feel grateful. I still have my maternal grandparents with me. And so very, very grateful for family.
Fantastic. Well, with that, we unfortunately have to wrap up what's been a great episode, one that we have spent a lot of time prepping for and getting to know you, Ryan. Really appreciate anyone that is willing to go outside of their comfort zone and put something out there that they feel passionately about, especially in this veterinary space at this time. So I commend you for doing that. And whatever conversation comes from that, huge respect on this end.
Thank you. I really appreciate that.
For anybody that wants to get to know you better, and we didn't even speak a lot on Obivet and other pursuits that you're in the middle of also trying to improve veterinary medicine, which is really key in taking continuing education down a different course. Where do people get a hold of you? Because I want them going that way.
Yeah, for sure. Thanks. So they can check out our site. It's obivet.com. They can follow us on Twitter at Obivet or Instagram at ObivetCE. My personal Twitter's Appleby DVM. So you can definitely get us on social, or my email, ryan@obivet.com. Reach out if you have any thoughts, ideas. I love to talk to people about our profession and where things are going. So feel free to reach out.
Fantastic. Well, conversation always ends with our guests. What message do you want to leave for the veterinary community?
Yeah, I think it's a tough one to find one distilled message to leave for everyone, but I guess my message would be just, think about the way you want to see things move forward and start to enact some of that change. And, the challenges that we face are huge, but we can do it as a group, as an organization of people. So let's not give up on this, and let's go forward.
Thank you for listening to the Veterinary Project Podcast. As a recap, on behalf of our hosts, the Veterinary Project Podcast will be releasing new episodes weekly, so be sure to tune in as we bring you more conversations aimed at helping you enjoy a life well lived. If you enjoyed what you heard on the show and you want to stay in the know, please like, love, and or subscribe to the podcast on the listening platform of your choosing, as we're available on all the usual suspects. If you know of others that may benefit from these conversations, we'd love it if you please share the show with them, as this will help us grow our community to reach more and more veterinary professionals. Speaking of which, if you are a veterinary professional and would like to get connected with more like-minded individuals who are joining us on this journey, please send an email to the veterinariprojectpodcast@gmail.com, and we'll invite you to be a part of our private Facebook group. General feedback, requests for information, or perhaps requests to be a guest on the show can also be sent to the Veterinary Project Podcast @gmail.com. Dr. Michael Bugg and Dr. Jonathan Light, thank you for listening to the show, and we'll catch you again next week for another episode of the Veterinary Project Podcast. Bye for now.